Namaste, myself Dr. Reha Rakholia. Today we'll be discussing about assisted reproductive technology law and assisted reproductive technology rules. ART Bill 2021 or ART Act 2021. Okay. So, first of all, what is ART? Assisted reproductive technology. What is it? It's a process where egg and sperm are handled outside the body, outside the human body. This is human body. This is handled outside the human body. Okay. For example, IVF, in which doctor fertilizes the egg in the lab and then transfer embryo back into the woman's body. Okay. What are the objective of this act? Objective is regulation and supervision of art clinic and art bank, prevention of misuse, safe and ethical practices of ART and ART research and development, means genetic. Chapters, there will be 6 chapters. Chapter 1 will be definitions. Chapter 2 will be authorities, mainly authorities, about authorities. Chapter 3 will be procedure for registration. Chapter 4, duties, about duties. Chapter 5 about offenses and penalties, and chapter 6 is miscellaneous. Okay. Now, chapter 1, definitions. About ART, I have already discussed. Now, ART bank. See, think of ART bank as a storage center. Okay. So, these banks collection of gamete, collect. Okay, collect. They'll store and provide or supply. Provide, they will collect, they will store, and they will provide uh, uh, sperms, egg, and embryos for the use in ART procedures. It's like having a safe place where these reproductive material can be kept until it's needed. ART clinic. What is ART clinic? ART clinic are medical facilities where all the treatment happens. Okay. They are, so it's necessary to register them. So they are registered with the National Medical Commission to ensure everything is done properly and safely. So if a couple needs help with ART, they have to go to one of these registered clinics. Okay. Now, what is commissioning couple? This is term is used for a married couple. Okay. Only commissioning couple can only be married couple. These are definitions. Okay. Married couple who cannot have their children. So naturally, who they are not having their children naturally and approaches an ART clinic or bank for help. Okay. Help. They are the ones commissioning the procedure to fulfill their dream of becoming a parent. Okay. So this is done, this is done, this. Embryos. What does embryo mean? Embryo is an early stage of baby development. This is an early stage of baby's development. It starts right after the egg is fertilized. Egg is fertilized. Okay. And continues to grow till 56th day. Till 56th day, we'll call it an embryo. It's like starting point of the life in the womb. Okay. After 56th day, like from 57th day to birth, it will be called as fetus. So what is fetus? A fetus is a stage that comes after embryo. Okay, it's begin from the 57th day and after fertilization and continue until the baby is born or the pregnancy is terminated, birth or terminated. This will be called as fetus. So you have understood the embryo and fetus, eh? Embryo and fetus. Now chapter 2, which talks about authorities. Chapter 2. First is authorities. First is National Assisted Reproductive Technology and Surrogacy Board. Then State Assisted Reproductive Technology and Surrogacy Board. Then National ART and Surrogatory Registry. And then authority, appropriate authority. Okay. So mainly 4 authorities are there. This is the hierarchy. See, National Registry and Surrogacy Board, think this as a head office kind of. Okay, for ART and surrogacy in India, it decide the rules and policies. This decide the rule. This decide the rules and policies. Okay, rules and policies for the entire country and ensure everything runs smoothly. Okay. Then National Registry. What is National Registry? It is like a record book. National Registry is like a record book. It's like a record book. It keeps track of all ART clinics and banks. Record of all in country. What they do is their result, like it will keep what they do, what are they doing, ART clinics and bank, their results and other details. Okay, it will keep a record book for that. Basically it is helping National ART and Surrogacy Board. National ART and Surrogacy Board. Okay, it's helping this. Okay, it's like a record book. Then State ART and Surrogacy Board, it is this work at the state level. It makes sure that national rules are followed in every clinic and bank. State level bank within the state. Okay, rules are followed, and it acts as a link between the central rule and the local clinic. And authority, appropriate authority. Fourth one is appropriate authority. Third one is state ART. Appropriate authority is like a local manager, we can say. Okay, it is not local manager, but we can say it's a local manager. It works in the ground level, checking clinics, bank. That is the work of appropriate authority. Okay. Now giving them license, ensuring they follow the rules. If there is any problem, any complaint, this is the authority that takes action. Okay, in simpler world, the system flows like this: national board, which make rules; national registry, which keeps record; state board, which implement rule in states; and appropriate authority ensure that the rule are followed on the ground level. Okay. Now we'll talk about national and state ART Reproductive Technology Board. First, national, we'll talk about national, okay? Power. What power it has? It can advise central government. First is it can advise central government. It acts like a advisor to the central government. It gives suggestion how to make things better, how to make policies better for ART. Okay. Now, second is reviewing and monitoring. Reviewing and monitoring. See, monitor implementation. This board keeps an eye on whether the art law, rules and regulation are being followed properly. It sometimes need improvement. It tells the government how to fix it. So review the rules, act rules and regulation, recommend suitable changes to the central government. Third is setting rules for clinics and bank. Like code of conduct. Okay. It creates code of conduct, how people working in clinic and bank should behave. Code of conduct. Okay. It also decide what infrastructure. It decide about infrastructure. Okay. Building facilities is needed. What lab equipment and tools are needed. Lab equipment and tools are needed. What kind of skilled people should work. What kind of skilled people should work. Okay. Now, fourth is overseeing performance. Seeing performance. The board check how well other bodies like state boards are doing their work and help them to improve if needed. Okay. Take step to ensure effective performance. Monitor bodies constituted under the act. Fifth is supervising function. Another function is supervising function. Supervise national registry and liaise with the, this liaise means coordinate with the state government. Then another sixth is pass order. Pass order, exercise other powers, and now other powers also. Okay. Pass order means it can has a power to make decision or give infrastructure according to the law when needed. In short, national ART board makes rules, okay, advises government, keep track of the clinics and bank, keep track of clinics and bank, ensure everything is running ethically and smoothly. For ART in India, its main body responsible for maintaining standard and protecting patient. Okay. Standards, maintaining and protective patients. Now we'll talk about the power of and function of the state board. State boards works under national board and follow its rules and plans. First is responsibility. What responsibility? To implement national rule in the state. The state boards, first is responsibility. The state boards make sure all the clinics and bank in the states are following the policies and guidelines set by national board. Okay. Follow policies and plans laid by the national board for clinics and bank in the state. First is responsibility, power of state. Second is function. Coordinate and enforces uh, enforcement of the policies and the guideline for ART, okay? And is exercise other power function as well. It ensured that rules are for assisted reproduction are implemented properly across the state. Okay, rules properly across the state. Third is compliance. It takes action based on the national board direction. If the national board gives specific instruction, the state boards make sure that they are being followed and can issue order to clinics and bank, give direction or pass order as directed by the national board. It's okay. Now, national registry, it's like a record book. It acts as a central database. It maintains detail of all ART clinic and bank, including the service they provided. Okay, details of the bank and the service they provided. Example, the National Registry keep data on how many successful IVF treatment were conducted by the clinic and the kind of service they offered, like egg freezing, embryo storage, everything. It keeps the data. Then first is this one. Second is it assesses the national board. How does it assess? It provides important data from the central database to help the national board make any decision. Okay. Then second is support the board in regulating ART services. Okay. If for example, if a national board wants to review the success rate of the ART treatment in our region, so the registry provide the necessary data for analysis. Then third is it support policy making and research. How it does that? It uses collected data to help develop new policies and guideline for ART services. Okay, making new policies and guideline for ART services. Then it identifies area where more research is needed. It identifies new research area and it conduct research in assisted reproduction and related field. Conduct research in ART and related field. Okay. Now, if the data show an increased number of complication during IVF in certain clinics, the registry can suggest new safety measures, new safety standards, or initiate research to understand what is the issue. Okay. Its other function is it may provide additional roles as prescribed by national board, and ensure all ART services follow the law and regulation. Now, appropriate authority. Appropriate authority is one when appointed for whole of the state or union territory. Okay. And second is for the region, state and union territory, and for the region. Now, here we are talking about state and union territory. Okay. They have 5 important member for state and region. I'm talking about 5 important member. First is chairperson. Chairperson. He's a senior officer from the Health and Family Welfare and Department. Okay. Chairperson, officer of or above the rank of joint secretary. Okay. He must be at the rank of joint secretary or higher. Chairperson. Then this person will lead the team. Okay. Then second is vice chairperson. Vice chairperson. He also should be the officer from the health department, but he should be at the rank of joint director. The chairperson was joint secretary. He must be joint director or higher. Then there should be a woman representative. Women representative who is a part of a women organization. She should be a part of the women organization. This will ensure that women's voice and concerns are considered in decision making. Then fourth one is legal expert. Fourth will be legal expert. He should be a senior officer from a law department. Law department. Okay. He should be at the rank of deputy secretary or higher. This person will handle all the legal matters. Okay. Then one medical expert should be there. He should be a registered medical practitioner. Okay. He'll provide a technical expertise. If any of these positions became vacant, the government must fill it within 1 month. Within 1 month. Members of appropriate authority, excluding the ex officio members, okay, shall receive only compensatory traveling expenses for attending the meeting of. There is no salary except the traveling expenses for these 2 members. These member, women representative and RMP. For ex officio, there may be salary, but for these 2 members, there is no salary, only travel expenses. When appointed, when any part of the state or union territory, that was for state and union territory. But if attended for some part of state or union territory, the state government of the central government, as applicable, may appoint officers of any other rank that they deem fit. What is the function of appropriate authority? First is granting, suspension, or cancellation of the registration of clinic and bank. Okay. Granting, suspending, and cancelling registration. Second is enforcing standard to fulfill by clinics or bank. Our clinic and bank must follow some strict rules and standards. Okay. And its authority job is to make sure they follow those. This appropriate authority job is to make sure they follow those. Third is investigating complaint. Investigating complaint. If there is a breach of law or any complaint about ART practice, the appropriate authority will investigate these issues and take legal action. Okay. And take legal action. Then Third, okay. Fourth is take legal action against misuse. If someone misuses ART technology, the authority can initiate the independent investigation and take legal action. Fourth one was action against misuse. Action against misuse. Then uh, fifth was implementation of act. Okay. Now supervise the implementation of the act, means they monitor how the provision of ART act and its rule are being followed. Okay. Implementation. Supervision of implementation. Supervision vision means they are seeing that if it's following or not. Sixth is recommending changes. The appropriate authority recommend update or modification to the rule of the national and state board, especially when technology or social condition changes. Okay, they can recommend changes. Seventh is any other function as prescribed. Any state or national board will prescribe any function to it. It will see that was powers of appropriate authority. These were the functions of appropriate authority. Now we'll talk about the powers of appropriate authority. What is the power is? Key three powers it has. Summoning people. They can call people if they suspect that someone has information about the violation of the law. They can call that person to come forward and share the detail. Okay. First. Second is asking for document. They can demand document, record, or material related to suspicious activity or suspected violation. For example, they might ask clinical record, report, and any agreement, everything they can ask for. Okay, they can ask for documentation. Then conducting searches. If they suspect a place like clinic or lab is breaking the rules, they have the power to search the premises and gather evidence. Okay. Like a detective, they are acting. They can call people, they can check document, they can inspect places to ensure everything is running legally and ethically. Other powers of appropriate authority. First is maintaining record. The authority must keep all detail about registration of art clinic, ART clinic and bank. Okay. Cancellation and renewal. It must track the cancellation and renewal of registration of these clinic and bank. Okay. Then it grant of certificate. The authority is responsible for issuing the certificate to commissioning couple and to women who are using ART for ART services. Okay. For commissioning couple also, this appropriate authority will provide a certificate saying, okay, like if they come for surrogacy, they will say, okay, you are fit for surrogacy. This will be provided by appropriate authority. Now, licensing detail. It should maintain record related to the granting license to clinics and bank. What license? That what procedure? The clinics registration is a different thing. Licensing is a different thing. Licensing is for some procedures you need licensing. So for that, appropriate authority has the power to give that license. Okay, that what procedure okay you can do. For registration is a different thing. Huh? Prescribed format. All these detail must be recorded in the format that is specified by guideline. Then submission to national board. These record must be submitted to the national board for monitoring and compliance. Then third is procedure for registration. Registration for ART clinic or bank. Okay. First is, okay, no registration, no work. What does that mean is, first of all, any clinic or bank that wants to handle ART procedure like IVF or storing eggs and sperm must be registered. Okay. If there is no registered, there won't be any work. If they are not registered, they cannot operate legally. Okay. Why is it? To make sure that patient gets in the safe hand and reliable services. They get reliable services. Second is how to get registered. Okay. Clinic and bank need to submit an application to the national registry. Okay. An application should be submitted to the national registry. National registry. They have to fill out the forms and pay the required fees. Once it is approved, they can officially start to continue their work. Then is, what about the existing clinic and bank? For clinic and bank that are already running when the law came into the effect, they must apply for registration within 60 days of the national registry being set up. Okay. Within 60 days of national registry being set up, those clinic which are already doing work should have applied for registration. If they won't register within 6 months, they have to stop ART services. They have to register. Otherwise, even the existing one had to stop ART services until they get approved. Okay. If they haven't applied within 6 months. Bank approval. So what does government check for approval is? They check for right infrastructure, right equipment, right trained staff, their facilities meet the high standard and quality standard. This way patient is protected. Okay. Rejection, application rejected if non-compliant with written reason and opportunity to be heard. Okay. Phase, when a clinic and bank apply, the appropriate authority has 30 days. 30 days to decide. Okay. If everything is fine, they will approve the application and give the clinic a registration number. Okay. If it's delay, if the authority does not decide within 30 days, they must explain the delay within 7 days. Once approved, state board is informed within 1 month. State board should be informed within 1 month if approved. Okay. Then how long the registration is valid? Registration is valid for 5 years. After that, clinic or bank must apply again to renew it. Okay, registration is valid for 5 years. And certificate, there should be displaying of the certificate at clinic or bank in the place where everyone can see the certificate, and certificate should clearly show how long it's valid. Now, renewal of registration. When ART clinic or bank expires, it should be renewed in 5 years. Renew it for another 5 years. Okay, registration can be renewed for another 5 years by applying the correct format and paying a required fees. If the application is going to be rejected, if you're rejecting the application, the clinic or bank must give a chance to explain or fix the problem. They should be heard. Like you cannot, appropriate authority cannot say, okay, we are canceling your registration. No, they should be given a chance to fix the problem and to be heard. Okay. To explain. No rejection happens without this. Okay. No rejection without explanation can happen. Then suspension or cancellation of registration and appeal. If there is a complaint against clinic and bank, the authority can issue a notice. Notice will be issued by authority asking them to explain why registration should not be cancelled. Okay. They should be given opportunity to be heard. We should give them a fair chance to explain or correct the issue. They should be given a fair chance to explain or correct this issue. If the authority finds that the clinic or bank is involved in the violation of the rule, the registration can be suspended or cancelled, and a copy of cancellation is sent to the state board for recording. Okay. Now, appeal process. This is suspension and cancellation. We have already talked. Now we'll talk about appeal. If a clinic, bank, even the couple using ART feels the suspension or cancellation was unfair, they can appeal to the state government if it's related to the state authority, or they can appeal to the central government if it's related to the union territory authority. Okay. Central government if it's related to the union territory authority. The appeal must be filed within 30 days of receiving the cancellation notice. Then national board, national registry and state board should have the power to, okay, what power they should have? Inspect premises. For inspection means they can inspect the ART clinic or bank premises related to ART services and document check. Inspect premises, call for any document or material. This in simpler terms, clinic and bank needs to renew their registration every 5 years and follow the rules to avoid suspension and cancellation. If there is an issue, the government ensures fair opportunity is given to explain and appeal, and the national and state board keep an eye on everything through inspection and checks. Okay. Now, fourth is duties of ART clinic and ART banks. First is eligibility check. See, ART clinic must make sure that the couple, the woman, and the donor meet all the rule for ART procedure. It's like a checklist to ensure everything is in the order. Second is about donor gamete. Clinic must only use donor sperm or egg from a certified ART bank. These donors are medically tested to make sure they are healthy and free from disease. Okay. Then counseling. Third is counseling. Clinic must provide a proper counseling to help the couple or woman understand the chances of the success, the risk involved, and any medical side effects or costs. Okay. This helps them to make a good informed decision. Then fourth is rights awareness. Means clinic must inform couple about their rights and about their rights and the right of child born through ART. The child born through ART also have rights. Everyone involved should fully understand the process. Now, confidentiality. Maintain confidentiality. All information about the couple, women, and donor is kept confidential. Okay, this data is only shared when it can be shared in emergency to the national registry, and if there isn't a court order, then it can be shared. Otherwise, not. This data can be shared. Huh? And grievance mechanism. Every clinic must have a grievance cell to handle the complaints. Okay, it should have a grievance cell to handle the complaint. Patient to know where and how to file that complaint if something goes wrong. See, who can use the ART clinic? ART services is only for women who are 21 to 50-year-old and men who are 21 to 55-year-old. Discharge certificate. After the procedure, clinics must give discharge certificate with all the details about the service and procedures performed to the couple. Okay. Then collaboration with the authority. We should cooperate after clinician must cooperate with the authorities. They must allow the national board and state board and national registry to inspect. Okay, inspect their premises. Then information submission. Clinics must regularly share their detail to the national registry about the couple or donor involved, about the procedure, its outcome, and any complication if that has happened. Okay, so clinics will make the national registry informed about all of these. Then we'll talk about the written informed consent. See, before any ART procedure, written consent is required. How it works is consent from all parties. Every person involved, the couple, the donor, must give written consent before the treatment start. Okay. Then insurance. For oocyte donor, insurance, the commissioning couple must provide 12-month, 1 year of insurance for egg to cover their if any complication occur to cover that. Now, cryopreservation rules. Clinics cannot store embryos or gamete without written consent. There should be written consent for storage of gametes, embryo, egg, or sperm. Okay, embryos or gametes. Without this rule applies even if cases of death or incapacity of patient. Then use of material. No embryos, egg, or sperm can be used without specific consent withdrawal of consent. Patient can withdraw their consent anytime before the embryos or gametes are transferred to the uterus. Then duties of ART clinics and bank to keep accurate record maintenance. First is detail of record maintenance. Okay, detailed documentation should be there. They must record all details about donors, gamete, and procedures. Donors, oocytes, sperms, embryos, used or unused, and manners and technique. Then online submission, update about the progress of the couple, number of donors must be sent to the national registry. To national registry, progress of commissioning couple, number of donor, sperm oocyte, screened, supplied within 1 month of receipt. Okay. Then retention period. Maintain record for at least 10 years. Transfer to National Registry database after expiry. Record must be kept for at least 10 years and transfer to National Registry if the clinic closes. Then legal proceeding. See, we have to maintain the record must be available for retain record during ongoing legal criminal cases until the final disposal. Even after 10 years, we have to maintain record if there is some legal dispute. Okay. Closure of clinic. Transfer record to National Registry if clinic bank closes before 10-year record period ends. Okay. Inspection access. These record must be available for inspection. Now, duties of ART clinic related to human gametes and embryos. Okay. See, oocyte retrieval. What it means is uh, clinic must carefully follow medical rules when retrieving oocytes, okay, to avoid complications like OHSS or other complication. Then second is embryo placement. No more than 3 embryos should be placed. Not more than 3 oocytes or embryo can be placed, but oocyte not oocyte, only embryos. Okay, not oocyte, only embryos. Embryos can be placed in the uterus in single treatment cycle. So there, this limits, what will it limit? Multiple pregnancy, which has many complication. It will limit multiple pregnancy. Okay. Then single source gamete. All eggs or sperm used for one treatment cycle must come from one donor. If a woman donates her egg, the clinic cannot combine them with the sperm from two different donor in same cycle. Okay, only one man's sperm can fertilize her egg to maintain genetic integrity. Like if you are using one egg from someone, you can like it's a female egg. You ask for the male sperm. You cannot if one egg from other male sperm and another egg from another male sperm, that you cannot do. You cannot do in one cycle. Only one donor has to be used. No mixing of sperm. We cannot mix sperm like we are using A sperms, X sperms. Then suppose X is a male and Y is a male. Okay. And we are using Y sperm and we mix all both the sperm. That cannot be done. You cannot do like that. Okay. For one cycle, only one person can give. Okay. No mixing. Then no embryo splitting. You cannot split like spontaneously. If it splits, it's okay. You cannot split the embryo to make it twin or like that. Okay. Posthumously gamete use means when the gamete like sperm and egg from a dead person can only be used if the person has given written consent before their death. Okay. Then no use of fetal ovum. You cannot, ova from fetus cannot be used in any IVF or ART procedure. This is a strict rule to avoid ethical issue. Okay. Other duties is perform other duties as prescribed by the regulation. Now PGD and sex selection. See, PGD used to screen embryos for genetic disease, pre-implantation, genetic diagnosis. Okay, it ensured that only healthy embryos are implanted. For pre-existing, it can be only be done for pre-existing disease, heritable or genetic disease only. It can be done, PGT of embryo. Sex selection is completely prohibited. You cannot do sex selection. It can be only be done if there is some sex-linked disorder or disease. Example, see, if example hemophilia is there. See, what is there is husband is husband is not having disease. Okay, so she will the male born might have the disease. Okay, but females can only be the carrier for the disease, but they won't have the disease. So sex selection can occur in such cases. Okay, we'll select a female child so that female won't have a disease, but if we select a male child, there is 50% chance son will have a hemophilia. Shall not provide, prescribe, or administer anything that increases the probability of the particular sex embryo. We cannot provide anything that increases the probability for a particular sex embryo. Then, okay, already done. Then, sources of the gamete. See, screening, collection, and storage of gamete must be done only by the registered bank. We have already discussed, and only men aged 21 to 55 year of age and women aged 21 to 35 year of age can donate. Okay. We have to examine donor for disease and shall not supply to more than one couple. Means an oocyte donor shall donate only once in her lifetime. Oocyte donor can only donate once in her lifetime, and not more than 7 oocytes shall be retrieved. From that oocyte donor, we should not retrieve more than 7 oocytes. All unused oocyte preserved by the bank for use of the same recipient. Those oocyte which are left will be preserved for the same recipient or given for the research after seeking, or we can give it for research after seeking written consent. Collect donor detail including name, Aadhaar number, address, and ensure confidentiality. Donor detail are collected but kept confidential. Then storage, transfer of gamete and embryo. See, storage can be done for gamete or embryo up to 10 year, not more than 10 year. Okay. After this, they must either be donated for research or discarded. Donated or discarded. Allowed to perish. Okay. Sale or transfer to the other parties is prohibited. You cannot sell it or transfer. Transfer for personal use are allowed with permission. Okay. Or outside India is prohibited, except in the case of the transfer or own gamete and embryos for personal use with the permission of the national board. Transfer to any country outside India for research shall be prohibited. You cannot transfer outside the India. Research within India allowed as per the prescribed regulation. You can use it for research as per the prescribed regulation. Then rights of the child born through the ART. The child is the legally the biological child of commissioning couple. Okay, biological child, legally biological child for commissioning couple. The child has equal right to inheritance and privileges as a natural born child. It has right and privileges available to a natural child. Donor have no parent right. Okay. Donor have no parent right over that child. Like example, a sperm donor cannot claim any custody or rights over a child born using their sperm. Okay. Now, chapter 5 is offenses and penalty. See, sex selection. First, we'll talk about sex selection assist ART. Prohibition on advertisement. No clinic, bank, or agent can advertise the service for sex selection ART. Okay. Uh, this ban include all form of media like internet, print, media, and other channel. Who any medium cannot advertise about the sex selection. The action like issuing, publishing, yeah, distributing, or communicating any such ads are strictly prohibited. Prohibited. Okay. Then now sex selection ART. Now, if some person has some clinic run an online ad claiming they have a help select a baby's gender, they face 5 to 10 year imprisonment. Okay. There will be or 10 to 25 lakh of money they'll give fine. This fine or both imprisonment and fine. Okay. They cannot advertise all this. Now, offenses and penalties. See, like child exploitation, abandoning, disowning, exploiting the child born through ART is strictly prohibited. Example, a couple using ART cannot refuse to take responsibility for the child after birth. Okay. Now, sell and trade, selling embryos, gamete, or running agencies involved in such trading is prohibited. Sell and trade is prohibited. You cannot sell and trade. Like a clinic cannot sell a frozen embryos to another couple for financial gain. Okay. Then import restrictions. Importing embryos of gamete into India without proper authority is illegal. Like an ART bank importing sperm from another country to gain profit. It is not, you cannot do that. Exploitation of the participant, like commissioning couple, woman, or donor cannot be exploited financially or otherwise. Okay. Forcing a woman to donate her egg multiple times for monetary benefit, this cannot happen. This should not happen. This cannot happen according to this law. Then embryo transfer violation, transferring human embryos to animals or males is strictly prohibited. Males and animals is strictly prohibited. Then sell for research. Okay. Sell embryos, gamete for research purpose. You cannot do that. Intermediates, using middlemen to find gamete donor is not allowed. To obtain or purchase gamete donor, it is not allowed. First time penalties for offenses are: first time offense, you'll have to pay 5 to 10 lakh fine. Subsequent offenses, again and again you are repeating the offenses, then 10 to 12 lakh 20 lakh fine, 10 to 20 lakh fine, and 3 to 8 year of imprisonment will be there. Okay. Subsequent offenses. Then offenses and penalty. Cognizable offenses. Court can act. How court handle these cases? Court can only act on complaint by either national board, state board, or any authorized officer. Okay. Then the offenses must only be tried by the metropolitan magistrate or judicial magistrate of first class. Cognizable and bailable. All offenses are cognizable and bailable. Cognizable means police can take actions immediately. Example, arrest. Okay. And bailable means the accused can get bail without major restriction. Then offenses by clinics and bank. See, executives are liable. If a clinic or bank commit an offense, the executive head is held responsible unless they can prove they had no knowledge of the offense, they don't know that offense was happening, and they took measure to prevent it, or they can prove that they have taken some measure to prevent it. Now, chapter 6 is miscellaneous. It is not of our concern. Okay, this is not for clinicians. Now, new amendment was made on March 2022 and June 2022. This March 2022 was not gazetted, but this June 2022 was gazetted. So in March 2022, some details about infrastructure and all are given. That is good. So I have taken that from the March 2022 one, and that some more slides which I find good from the March 2022 I have taken, and from the June to other slides are from June 22, which is gazetted and which is more important. ART clinics. There are two levels of ART clinic. Level 1, which include IUI. Okay, and the other level is level 2, which includes surgical retrieval of gametes, handling of oocyte outside the human body. Use sperm for fertilization of oocyte. Oocyte we have to handle outside the body, and we are using sperm to fertilize the oocyte. Transfer of the embryo into the reproductive system of women, matlab embryo transfer. Then storing gametes or embryo for future use, storage. Okay, provided that such clinic may also undergo research. ART bank responsible for screening, collection, and registration. Screening they'll collect the gamete or and register of semen donor, and they'll do cryopreservation of semen, perform screening and registration of the oocyte donor also, operate as a sperm bank or oocyte bank or both. If someone require oocyte, they'll give because they'll act as a bank for oocyte and sperm. So if someone wants it, they'll give it. They'll maintain the records of all the donors and will update to the national registry, will update in the national registry, as national registry is a record book, like it acts like a record book. So ART bank has to update the national registry regularly. Then registration charges for label 1 clinic. That means if you are doing IUI, you will be charged 50,000 for registration. If you are doing label 2, that means IVF or other things, you'll be charges 2 lakh. And for ART bank, 50,000. And if the establishment is run by the government, there will be no fee. Medical examination of donor, sperm or oocyte donor should be tested for HIV, HBV, HCV, and Trypanosoma pallidum, syphilis through VDRL test. Duties of ART clinic: unused gametes. Unused gametes or embryo cannot be used for other recipient. The same recipient can use, but it cannot be used for other couple. Okay. Then for oncofertility or other such cases, gamete can also be stored more than 10 years. Usually gametes are stored, cryopreservation of gametes are done for gametes and embryo are done for 10 years. But if there is oncofertility case or other such cases, it can be done for 10 years, but with the permission of national board. Okay, there should be measures should be taken to prevent OHSS. Then PGT. PGT is only done for inheritable diseases or genetic diseases. It cannot be done for sex selection or for if someone wants, if someone will say, I want black hair baby, or if someone will say, I want blue color eye baby. That way, it cannot be done. Means genetic trait selection cannot be done. Okay. For sex selection, altering genetic trait. Then other duties are to maintain forms. From 6 to 13 forms are maintained by ART clinic. 14 and 15 forms are maintained by ART bank. These all forms I'll make you remember with mnemonic, picture mnemonic. See, first form is registration of the ART clinic, registration of ART clinic. Second form is registration of bank, ART bank. Third form is certificate of registration. Third form is certificate of registration. थोड़ा इधर shift हो गया. Third is certificate of registration. Fourth is appeal to government. Fifth is grievance redressal. Grievance redressal means complaining. Okay. Sixth is form for consent of women or commissioning couple. Consent for women or commissioning couple. Seventh is consent for IUI with husband semen. And eighth is consent for IUI with donor. Now see mnemonic. First is registration for ART clinic. See, this is clinic. You can remember this, that first is registration of ART clinic, then bank. Second is registration of bank. Third is certificate of registration. See, certificate of registration we have got. Now appeal to government. Okay, now appeal to government. This is first, this is second form, this is third form, and this is fourth form. Fifth is this is called PAG system. We can use the picture to remember numbers. Okay, so see, this person has been hooked or has been hanged with a hook. Hook look like 5. Okay, so that's why they are complaining. So fifth is because we hang this person with the hook. That's why they are complaining. So fifth is complaining, grievance redressal. Sixth is this look like 6, golf stick and golf ball. Okay, this look like 6. So we beat the couple with the, or we beat the couple, or we tell that we'll beat you if you won't agree. It is just to remember, funny ways to remember. So they sign the agreement, means consent for women or commissioning couple. Seventh is 7. Husband will take you to 7 heaven. So IUI with husband semen is 7. But donor look like a snowman. So 8. Form of donor is form 8. This 9. Now till 8 we have done. Now 9, 10, 11, 12. 9 is freezing of 9. 9 is consent for freezing of embryo. 9 is consent for freezing of embryo. Form 10 is consent for freezing of gamete. 9 for embryo and 10 for gamete, and both are for freezing. And 11 is assent for freezing of gamete, sperma, oocyte, and parental consent. This is for minor. Like who is suffering from oncofertility or something. So parental and both the person who is involved, for that consent form is there, form 11. Okay, it is related to the minor, like if they are suffering from oncofertility, for them this form is sent. Then 12 is consent for oocyte retrieval. 13 is consent for oocyte donor. 14 is record of use of donor gamete. 15th is consent for form for donor of sperm. And the 14th B is for embryo. And 14th A is for sperm and oocyte. Okay. See, this 9 look like a balloon. So it is freezing. It is a visual mnemonic. Okay. This balloon and 1 and 0. This is thin person and this is a fat person. It looks like 10. They both are freezing. So 9 is for embryo freezing. 9 is for embryo freezing, means when there has been fertilization has been taken place, embryo freezing. Okay. And 10 is for gamete freezing. 10 is for gamete freezing, either sperm or oocyte. Then 11 is an angel number. 11 is an angel number. This girl is an angel. She's a minor and she's having chemotherapy is being treated with chemotherapy. So this is 11, means a minor uh, form. This one. 12 is oocyte retrieval. See, this carrot contains 12 eggs. If we'll retrieve them, then 12. 12 is for oocyte retrieval. 13 is, see, like butterfly undergo metamorphosis, donor often play a transformative role in someone's life. So 13 is related to oocyte donor. Okay. Oocyte retrieval and oocyte donor. This 14 is Valentine Day. 14 is related to record of use of donor. 14 is related to record. See, records are there. So record of use of donor is 14. 15 is independent. Independent Day is on 15th, no? Indian Independent Day. So the sperm donor has signed the consent on 15th. So he felt independent. Sperm donor, okay? So this is the consent form for sperm donor. Now, staff required and qualification of the staff in the ART clinic. ART level 1, minimum 1 gynecologist with PG degree. ART 2, 1 gynecologist, 1 anesthesiologist, 1 embryologist, and 1 counselor. Additional, 1 director can be there and 1 andrologist can be there. Director and 1 andrologist. Now, qualification for level 2, she should have a degree in the, she or he should have a degree in the gynec and ops postgraduate, PG in OBGY, PG in OBGY plus 50 ovum pickup she should have performed, she or he should have performed under supervision of ART specialist, or and not or and 3 year, at least 3 year of working experience in ART clinic under supervision. Okay. Now, alternative qualification is either she should have been a MCH in reproductive medicine or surgery, or fellow. MCH is already for 3 year. If she's a fellow, she should have completed 3 year. 3 year in the ART clinic. Okay. 3 year experience should be there, even if she's a fellow in the reproductive medicine and surgery. This actually is hidden here. Okay. 3 year is required. 3 year experience is required. Now, staff in ART clinic, andrologist. We will talk about the andrologist. Education requirement is MCH or DNB in urology. Special training should be in diagnosing and treating male factor. Then we'll talk about embryologist. We can choose anyone. Postgraduate in clinical embryology and with 3 year experience of ART lab handling human gamete and embryo. Then second is clinical embryology. Okay. Second is PhD in clinical embryology, either PBG or PhD in clinical embryology or reproductive technology or fertility with at least 1 year of ART lab experience in handling human gamete and embryo. Third is MBBS or veterinary graduate. Veterinary graduate with plus postgraduate degree in clinical embryology. They were also having postgraduate, so they want an experience of 3 year, but they are MBBS and veterinary graduate, and they are doing postgraduate in clinical embryology. They just should have 2 year experience in handling human gametes and embryo. Postgraduate in the science and or postgraduate in the science and in life science and biotech. If the person is postgraduate in life science and biotech, they should have 1 year experience, 1 year training, 1 year on-site training, and full-time embryologist training. 1 year on-site full-time. Okay. 1 year on-site full-time embryologist training and 4 year experience in handling human gametes in the ART level 2 clinic. Okay, if he or she is postgraduate in life science and biotechnology, they should have 1 year of full-time embryologist training, um, and 4 year experience. 4 year experience in ART lab, ART2 clinic in handling gametes and human gametes. Okay. Now, other staff is counselor. Counselor play a key role in the supporting patients emotionally throughout their fertility journey. Now, they must hold a degree in psychology or clinical psychology. Graduate, okay, graduate in psychology, clinical psychology, nursing, or life science. Anesthetist, postgraduate in anesthesia. Director, postgraduate in, director should be postgraduate in medical science, life science, or management science. Minimum equipment in ART clinic. In level 1, we require microscope. Level 1 is for IUI, centrifuge, and refrigerator. In level 1, we require these 3. In level 2, we require microscope, incubator, minimum 2 in number. Minimum 2 microscope should be there. Laminar airflow should be there. Sperm counting chamber should be there. Centrifuge should be there. Refrigerator should be there. Equipment for cryopreservation. Ovum. This is for level 2, huh? Ovum aspiration pump, ultrasound machine with TVS probe and needle guard, test tube warmer should be there, anesthesia resuscitation trolley should be there. Minimum require equipment in ART bank. Centrifuge machine should be there. Incubator should be there. Microscope should be there, and laminar airflow should be there. According to ART rule 2022 March, which was non-gazetted March ART rule, this should be the infrastructure. Okay, like what should be there? Reception room. Reception room should be there. Reception and waiting room should be there. This is a comfortable space where patient can wait and relax before their appointment. Okay. Second is consulting room. What is the consulting room? Consulting room. This is a separate room for male and female. They should have all needed equipment like gynecological instrument, ultrasound machine, and a female attender must be present if you are examining a female patient. If a male doctor is examining a female patient, okay? If female doctor is examining a female patient, there is no need for female attendant. But if a male doctor is examining the female patient, you need a female attendant. Then third is semen collection room. Semen collection room is a private and a clean room near lab. Okay, it should be near lab and it should have facilities like wash basin, toilet, and there should be a sterile container for semen sample collection as per a WHO guideline. Then fourth is semen processing lab. Semen processing lab. There should be a dedicated lab with laminar airflow. This is according to the March ART rule 2022. Okay. There should be a dedicated lab with laminar airflow for safely processing semen sample and for a proper disposal. There should be a proper disposal for waste material. Okay, system for waste disposal, proper system for waste disposal. Then fifth is IUI room should be there. IUI room should be equipped with proper table for performing IUI procedure. Sixth is clinical lab should be there. Clinical lab should either clinical lab is see in-house or referral. In-house or referral. So it is for quick hormone analysis, sometimes like estradiol, sometimes to prevent OHS, we need quick value of estradiol. So it is important that clinical lab should be there, which can provide us report quickly for all blood tests. It can be in-house or it can be referred lab. Okay, clinical lab. Then microbiological and histopath lab should be. It should be nearby or within the clinic for quick specimen test or quick infection test. Okay, it should be there. Yeah, 6 and 7. 8 is autoclave room. There should be a room for sterilizing surgical instrument and culture item. Autoclave room. Another is OT should be there, which is fully equipped with OT with the equipped with the equipment which is required for ovum pickup. And maybe some people do it is not recommended, but some people do hysteroscopy in the same OT, but it is not recommended. So then for that also endoscopy or something they are, if they are doing, you should have equipment there. Okay, and embryo transfer room should be there. Sterile, quiet room for embryo transfer is directly connected to the embryology lab for easy handling. Then IVF and culture lab. This is very important. IVF lab. This lab should be there with controlled temperature, humidity, and air filtration. And it should have all the equipment like microscope, incubator, and there should be system for freezing and all those things. Huh? This is the core like heart of IVF. There should be an sterile area. A storeroom should be there. A well organized storeroom should be there for keeping sterile and non-sterile items with the if needed refrigerator should be there because we have to keep media and all those things. Record room should be there. 13 record room. Cabinet should be there. Cabinets are like almiras. Okay, they should be fireproofed. Vermin proofing should be there in the IVF lab. Vermin proofing means there should be proper measure to keep the insects and pests outside the lab without using harmful chemical. We cannot use harmful chemical in the IVF laboratory. Vermin proofing. Then regular cleaning, calibration of equipment, monitoring that the environment is sterile, and to maintain a high quality standard should be followed. And we have to always use non-toxic sterile material. Okay, and we have to ensure that culture media is tested for infection like HIV and hepatitis, and there should be a backup power to ensure uninterrupted power supply with a reliable backup like UPS or generator should be there. Then renewal of registration of the clinic or bank. See, first is the certificate of registration cannot be transferred to someone else. Okay, example, if Dr. A sells the clinic to Dr. B, he cannot say that, okay, I'll transfer my certificate also. No, Dr. B has to apply for the fresh certificate. Okay, first. Second is ownership and management changes. If the owner or management changes, a new registration must be applied for. Okay. Example, if hospital management changes, okay, then new application is required. New application for registration of the clinic is required. Third is renewal. Application for renewal, it should be submitted to appropriate authority within 60 days before the current registration expire. Within 60 days before the current. This is very important. Example, if my IVF lab is expiring on March 31, I can apply by January 30. Validity of renewal. Renewal is done for 5 years from the date of expiry, provided all the rules are followed and requirements are met. Then if renewal is rejected, like I have applied it today, okay, within 30 days, if they reject my removal, within 30 days they have to provide the reason. Within 30 days from the application date. If the requirement are not met, renewal is rejected, and rejection is communicated with the reason within 30 days from the application date. If rejected, you can appeal to state board within 30 days of the rejection. Like example, if registration is rejected on May 1, the appeal must be filed till May 30. Till May 30, you can file the appeal with state board. And state board decision. The state board must make a decision within the 60 days of the receiving the appeal. If rejected, you have to return old certificate to the authority immediately. Okay. And if renewal fails, clinic can finish. Now, now clinic has to, if rejected and renewal fails, clinic has to finish ongoing IVF procedure for within 90 days. Okay, within 90 days all IVF procedure should be completed, and no new admission, no new IVF cases they can take. And after that, gamete must be sent to another registered clinic or bank, because this clinic has been rejected. They cannot practice IVF now. Notify the appropriate authority about the change of equipment, change of address, and change of employee at least 30 days in advance to the expected change. Okay. And during oocyte retrieval, aim is to retrieve no more than 7 oocyte in one cycle from our donor. But retrieval all follicle, we can retrieve all follicle if it is necessary. Okay. Now, perform semen culture on all sample before preservation to check for infection. Semen culture have to be done to all semen sample before preservation. Then, clearly separating, we have to separate quarantine, unscreened, tested negative, and tested positive. What is quarantine? That means there should be, these are the gametes and embryo which are awaiting their result for HIV, hepatitis B, hepatitis C, and other infection. Result are awaited. Then unscreened means they have not yet screened for infectious disease. Okay. Then tested negative means there should be dedicated storage for gamete and embryos tested negative for HIV, hepatitis B, HCV, and other infection. Then tested positive means that they have tested positive for HIV, hepatitis B, hepatitis C. Then have a separate storage for the test similar infection. Now, okay, storage facilities requirement. See, we have to make sure that storage area should be away from radiation, infection sources, and contamination sources. And we have to minimize handling. Like we have to make the system as such, there should be reduced handling of gametes and embryo during retrieval. And we should have plan for emergency situation like damage to storage vessels or failure of storage conditions. Like we should have backup system for liquid nitrogen storage. Okay. Maintain detailed record for every handling instances should be recorded, and the personnel who handled the gametes or the embryo should be also be recorded. Okay. Example, uh, who assist, who transfers, who transferred, who processed the sample, all should be recorded. Then storage destination, gametes and embryos must be stored in a specific area, and cryocans, the storage device, should have alarm and an automatic system to alert the staff about any issue. If there is any issue, it should alert the staff. After hours system also should be there, means center should have on call system for after hours emergency. There should be some personnel who can, even if there is an emergency, even after working hours, they can come and see. Okay. And there should be a spare storage capacity for transferring sample when needed. uh, we should have some space. If there is some emergency, we can transfer the samples. Okay. Then emergency backup plan. Now if there is some power failure or there is fire outbreak, so we should have a backup plan. Backup generator should be there. Fire safety equipment should always be ready. Like, then spatial storage for certain sample. uh, say like sample for patient with the potential for future fertility issues, like oncofertility and all those patient. The sample should be stored in two different vessel. If something happens to that vessel, we can avoid the risk. Okay, because we have stored in two different vessels. This is an important point. Then transfer between clinic is not allowed. Gametes and embryo transfer between clinics is allowed only with the permission of the national board. And there should be complete record of the transfer and consent of the both registered ART clinic in which the transfer is occurring. Thank you.